Hello, thank you for joining me today. I'm Danielle with Integrative Arts and Medicine at Tampa General Hospital. And as well as being a music practitioner, I'm also a registered yoga instructor. So today we're going to do some gentle seated yoga. I'd like you to find a comfortable seated position, but one where you can be upright. So as you might be able to see, I'm at the edge of the seat so that my spine can be elongated and I'll have access to move without being hunched over like in a couch or something like that. Okay, so find yourself in a comfortable seated position and we'll get started shortly. I'm pregnant right now, so I wanted to say that this is also going to be gentle enough for any of the prenatal mamas out there. Also, if you sit for a lot of your day, this is going to be perfect for you because we're going to be doing some just upper body and hip openers that you can use anytime you're sitting, watching TV, sitting at a desk, anytime really, except for driving. So find yourself in a comfortable position, and also please turn off any alarms or alerts that may happen, any other sounds like other TVs or things that may distract you, and allow yourself this next 15-20 minutes to just relax the mind and the body. Okay? We're going to get started. If at any time you feel pain or discomfort or feel out of balance, like you may fall out of the chair, please stop. You shouldn't feel any pain during this. You'll feel like you're stretching, but not anything that's like a stabbing pain. And I definitely don't want you to feel out of balance to where you may fall. So if at any time you feel like it's not right for you, then just stop and maybe wait for the next stretch. And I hope that you can have some time to still the mind as well. So let's start there. Let's start by focusing on the breath. What I'd like for you to do is try to imagine that you're fogging up a glass and have the breath come out like a little bit of a sigh or a in the back of the throat. Breathe in fully from the belly up and exhale with that fogging the glass, sighing feeling in the back of the throat. We're going to do a couple more of those. Just preparing our bodies and our minds for a few more moments of stillness. Now let's start by bringing our chin toward our chest. And remember to breathe when you're in a stretch and not hold your breath during any of this time together. Then bring the right side of top of your head over to the right side of your body and rotate forward and over toward the left side. Rotating the head in the front of the body by the chest to the right shoulder, and rotating forward over to the left shoulder. And you might notice that in certain spots it might be a little extra tight, like maybe right in the middle there, and you could stop. You can stop at any point and just breathe there. Or you can keep moving right and left. And on this next one, I'd like you to bring your head to your right, and then as the side of your neck is elongated here toward the right side of your body, I'd like you to turn your chin toward the ceiling, like you're just turning the side of your face to look up. And you might feel a little bit of a different stretch. And breathe there for a moment, then let loose, coming forward, going over to the left side, pausing there on the left side, and then bringing the chin toward the ceiling. And breathing there for a moment. And then letting that rest, bringing your chin toward the middle of the chest again, elongating the neck straight up. Bringing the shoulders up, back and down, up, back, and down. And imagine that your neck is elongated to the top of your head. Nice. Now let's open up the arms to the side of the room, reaching. And open your hands toward each other, toward the front of the room. And bring your hands toward each other and then reach up like you're trying to touch the ceiling. And we're going to reach right a little farther and then left a little farther. Right a little farther, left a little farther. And always breathing. And bring the arms back and down. And shake that loose a little bit. Good. Now let's reach forward toward each other, curling the lower back and curling the shoulder blades, curling the chest. Reach with the arms and the fingertips, and then bring it back, open the chest, and bring your arms back like you're reaching down toward the floor or back toward each hand behind you. That might not be very accessible for everybody, so reaching down toward the back of your chair, opening up the chest. And again, coming forward, reaching forward, curling the lower back, curling the upper body, reaching all the way through the fingertips, and opening up the chest, curling the arms back, reaching back and down to the floor. You may feel comfortable looking up a little bit, and then shake that loose. Good. Placing your right hand on the chair or on your leg for support so that you don't fall over. I'd like you to reach up with the left hand. Reach like you're trying to touch the ceiling, and then start to lean over toward the right side of the body. Oh, and breathe. And if it's not painful for the neck, you can turn the face up to look toward the ceiling. And reaching up, using the right hand as support to push up, and letting that loose. Now using the left hand as support on the chair. Right hand reaches up, reach toward the ceiling, reach, and then start to lean over, using that left hand as support to brace you. And if it's comfortable and not painful for the neck, you can turn the face to look up toward the ceiling. And breathe. And then reaching, using the left hand to push up as support and shaking that loose. Good. Okay. We're going to bring the arms forward again. This time we're going to cross right over left. And if it's suitable for you, you can grab your shoulders and see if you have any mobility there to move the elbows up and down. If that's not quite enough for you, you can try bringing the back of the arms toward each other and again moving the elbows up and down. But it's better to have a little bit of range of motion, a little bit of mobility. So if you're more comfortable here to be able to move the elbows, that's fine. And breathe here. Allow this to open the shoulder blades. And bring the elbows up. Bring the elbows down. Again like this, elbows up, elbows down. And then relax, release and shake loose. Bring some attention to the tailbone. Tuck the pelvis forward so that the tailbone up to the top of the head is one straight line rather than the lower back kind of curling out, because you can create some tension and pain there in the lower back. So if you tilt the pelvis forward, engage the stomach muscles, it releases that pain in the lower back. but we're trying to create a straight line. You don't want to be so curled over that you're actually curving the back forward. Just trying to create a straight line from the tailbone up to the top of the head. Okay. Crossing left over right this time. We're going to grab the shoulders if that's best for you, or back of the arms if that suits you. But again, with no pain, just a little bit of stretching, but no pain. And breathe here, opening up the shoulder blades, almost moving the elbows toward the front of the room, toward the front of your body, to curl the upper body a little bit. Bringing the elbows up, bringing the elbows down. Like this, it's bringing them up, bringing them down. Up, down. And breathing. And then releasing and shaking that loose. Good. Let's bring the right foot over the left knee. Now this may be tight. It's tight for me, and I do a lot of yoga, but some days are different, and some days I'm a lot stiffer than others. So if this is too tight for you to get your foot on top of your knee, then don't worry about it. And what you'll do is bring the leg up toward the knee, lifting up as you engage to lift the leg, engaging the stomach muscles to lift up and down, up and down with the left. And you'll go back and forth like that, just lifting the leg up toward the knee and back down. That's if you can't get the foot on top of the knee at this time, and that's absolutely fine. But if you can get your foot on top of the knee, try to do that and sit here elongated in the spine, just resting and opening this hip. You can tap the knee gently to soften, allowing those muscles to release any bound tightness. And only if it suits you, you can hinge forward like a door. So with a straight back, hinging forward and hinging back. Hinging forward and hinging back. And if your foot is not able to get on top of the knee, you do the same thing, elongated spine from the tailbone up and hinge forward, using your hands as support on the knees, and hinging back. Hinging forward and hinging back, okay? Back here one more time. And breathing. Try not to hold the breath. Let the flow happen in the back of the throat. Softening the breath, lengthening the inhale from the belly up. And then we're going to switch. You can tap the legs a little bit to shake the hips loose. And we're going to move to the left. Again, if it doesn't suit you, do this movement, bringing the foot toward the knee and alternating until we do the hinge. Bringing the left foot up, tapping the knee just ever so slightly to let anything that's bound up soften. Breathing and hinging. Straight back like a door hinge. Moving forward and moving back. Moving forward and moving back. And if you're in this position, moving forward and moving back. And again, creating a little flow. Good, and let that release. Then I'd like you to feel the difference between a hinge forward and a curl. So what we're going to do is hinge first and then curl over. Curling the lower back, curling the upper body, hugging the bottom of the thighs, and then roll back up. And we're going to do that one more time. Hinging first, then curl. Hugging the lower thighs. And you can even, when you're down there hugging, you can pull a little bit with your arms to strengthen and engage the upper body muscles. Nice. Curling up and relaxing, letting it all loose. Very nice. Bringing your right hand to your left knee. I'd like you to, first in this position, elongate like you're stretching the tailbone up to the top of the head, and then turn the head toward the back, looking over the left shoulder. And breathe. As you exhale, you may find that it's more comfortable to soften a little bit deeper, but only if it doesn't cause any pain. And you can release that. Come forward, then left hand on the right knee. Right hand in the back can help sometimes to lengthen yourself up, elongating the spine, and then tilting the head to look back over the right shoulder. And breathe here. And if there's no pain, you might find in an exhale that you're able to twist gently a little bit deeper. And release. Come forward and shake that loose. Let's bring our attention back to our breath. And start to soften the mind again. Allow yourself to have a couple moments of stillness where you're not really thinking about anything. If your mind wanders to distractions, that's absolutely normal. And you just say, not right now. And you bring it back to the stillness, or if it's easier for you, bring it back to focusing on the breath. Being soft, full and long. And I'd like you to imagine that you are surrounded by a warm light, kind of like a sphere or a bubble of light surrounding your whole body. And you're resting gently in this bubble of light. For some people, they like to imagine a color, and some days are different than others, and you might have a color that pops into your mind. That's absolutely fine. For me, I like to start with a warm light, kind of like a sun, like a golden light. And I try to see if I can make it a little bit lighter, as in whiter and brighter, in my imagination. And imagine it surrounding the whole body. And it waves sometimes. Sometimes in my meditation, if I try this, it'll be like I just feel a little bit, I just can imagine a little bit of light right in my core or around my head or around the upper body, and then I try to just focus on expanding it, imagining it being expanded around the whole body. And even if this doesn't do anything else, it gives your mind a positive, gentle focus. It gives your mind something to attach to that is in this state of stillness. So you're not wandering to other distractions, what you have to do today, lists or negative thoughts or worries or concerns, stress. Giving your mind an image is an easy way to shut off all that extra chatter and just give the body and the nervous system a restart, a little pause. For some people, they prefer to just rest in stillness of, the blankness of our eyes being closed. And if you can do that, that's great. For other people, an image is really important to keep their mind from wandering. I also like sometimes choosing a peaceful image of a place that I've been before that I can remember and recall, and resting in a beautiful, peaceful place that has just made me feel calm in the past. I'm going to give you a couple more moments to rest in your stillness, whatever that may be. Allowing the neck and shoulder and back and stomach muscles and hips and legs to soften as you rest and reset with your breath. And if you like, you can stay here as long as you want, until the mind won't let you. But hopefully you can carry this feeling, this sensation of stillness and calm into the rest of your day. I hope those stretches were simple and gentle enough for you to do in your routine every day. We sit so often that it's easy to sit in positions that aren't actually aligning our body. So, curled up on the couch in a position that's not necessarily allowing the muscles to reset. So I just encourage people to, let's say you're about to settle in for a movie or settle in for bed, or even let's say you're working at a desk, you're going to be seated for a length of time. Before you settle in or in the middle of the day, take a pause so that you can allow the muscles and the spine to realign. And then you might notice that by the end of the day, there's a lot less aches and pains here and there. Or you might just be so aware of the aches and pains that now you know how to tune into them and help yourself to relieve those aches and pains. I hope that's helpful for you, and I hope you have a relaxing day, and I thank you for joining me.